Hi, my name is Melanie, and I am from Lowndes County, Georgia. I have a very significant story to tell as it relates to the healthcare system here in Georgia. At the young age, the tender age of 19, I was diagnosed with a very rare and serious cancer. But had it not have been for the fact that I had just given birth to my oldest daughter and still retain the Medicaid health insurance that I was eligible for during my pregnancy, I would not have been able to receive the needed care that I received um, during my radiation treatments and my surgery for my thyroidectomy that I received at the age of 20. And so that speaks volumes. The access to such insurance coverage was quintessential for my own existence. It is quite obvious, it's quite possible that had I not have been able to receive those services, that it is quite possible that I may not have been here today. But because I had that medical coverage, I'm here today, and I am able to provide this testimony. There are so many hospitals in South Georgia and Southwest Georgia that are closing, and this causes communities to have to travel for 30 plus minutes to an hour to be able to seek emergency care services. And this should not be. This should not be. When there are millions of dollars available to assist in the expansion of our healthcare system, this should not be an issue. Access to healthcare should not be an issue when there are resources available. So I would impress upon our government and pray that our government would consider the care and the needs of our communities and consider the best interests of our communities and take that to heart when making the decisions to expand the healthcare system here in Georgia, because it's not a luxury, and healthcare should not be considered a luxury. It should be a right, and it is a right. Thank you.
My name is Brittany Lockett. I'm 36 and I'm from Leesburg, Georgia. A couple of years ago, before I even got accepted for Medicaid, I found I was a diabetic. And I remember not being able to go to the doctor, not being able to buy my insulin shots due to the cost. Me working a part-time job at a clothing store and restaurants, and I just couldn't pay the bill to get my medicine nor go to the doctor, and my sugars had got out of control in the 400s and 500s. It saddens me when I look around at friends, when I look around at family members or people in my community who is suffering, not only physically, but mentally, because they don't have the money or the right insurance to seek help from a doctor, from a psychiatrist, or anything.
My name is Sandra Ford. I'm from Calhoun County, Edison, Georgia. I currently don't have health care, but it's impacted me by all the doctor visits that I have to miss due to not having health care insurance. I think it's important why everybody should have health care, so therefore they can take care of themselves a little bit better as far as their health and be able to know what's going on with their health. I think everybody should vote. Start voting more for health care for us. That's what I feel like everybody should do.